there is. I'm joined by Tiffinie Cobb from the Milwaukee Health Department, also Sarah Zarati. Let me begin by thanking you, Ms. Chairman, for inviting us here today. Our presentation will be somewhat short. Simply, we did receive a request just 2 days ago, so we did want to indicate, though, however, that in the original legislation that created the task force, there needed to be a more regular update to this committee on a quarterly basis, so please accept my apologies for that not occurring. I recently became the chair of the Open Heroin Cocaine Task Force recently, so we will make sure that that report is given to you on a more timely basis going forward. The task force has certainly been very busy. A lot of activities have taken place during the time of the task force discussions. So we've had some issues as relates to staffing to the task force. I'll be very blunt. For nearly half a year, over a half a year, we didn't have a staff person. There was a vacancy, and it was not filled. Fortunately, it has been filled just recently by Ms. Tiffinie Cobb, who is doing an outstanding job, and we're very pleased with her work. She comes from her master's degree from the School of Public Health, UWM, and my alumni. So I'm very proud of that school. But Tiffinie, Ms. Cobbs, is doing a great job. So we're going to do a quick briefing of what we're currently at. I will tell you this to give you, I come to you talking about this issue because it is really the #1 public health crisis facing our country. And unfortunately, recent statistics just came out yesterday from the Center for Disease Control pointing out the United States saw a 30% increase in overall deaths in the last 14 months. Unfortunately, the worst state, I believe, of the union is Wisconsin. Wow. We saw a 109% increase. So it has been a very difficult year for the state of Wisconsin, which certainly includes our city and county. So it is an issue in which in Milwaukee County saw, it'll probably be approaching, when the final statistics are released, nearly 400 people in Milwaukee County who lost their lives through overdose deaths. That's a staggering number. So we have a lot of work to do, and I'll let the presentation go forward with Ms. Cobb, and I'll be happy to answer any detailed questions.
Good morning. Thank you, Chair and members, for allowing me to give you an update on the task force's plan. My name is Tiffinie Cobb, and I'm the Substance Abuse and Injury Prevention Manager with the Health Department. I've been in this role for just a little over 2 months, and we'll start with an overview. I'm here to present information regarding the purpose and process of the task force, provide you with an update of the actual plan, and then discuss recent collaboration efforts and share an overview of the next steps. So the task force was designed to investigate and make recommendations regarding ways to ensure long-term health and safety of the city and county's residents by reducing fatal and non-fatal overdose from misuse of opioids, heroin, as well as cocaine in both powder and crack form through data-driven public health prevention approaches. So the task force is a broad representation, so that it includes multiple sectors from city, county, and state agencies, as well as those with lived experiences. It was designed to meet regularly, so last year they met about 8 times, and we've met 2 times so far this year. And within those times of meeting, they also included public comments, and those comments are also incorporated into the plan, as well as 2 community meetings in 2 different neighborhoods, North Side neighborhoods and South Side neighborhoods. So the focus areas of the task force were identified by its members, and it includes enhancing and funding existing prevention programs to keep individuals from developing substance abuse disorder, reduce the number of opioid deaths related related deaths in Milwaukee County, ensure there is adequate access to timely, affordable, and quality services for those who are experiencing substance abuse disorder. Also, to develop programs in collaboration with the criminal justice systems that treat addiction as disease while actively working to reduce the availability of illicit substances. Other focus areas include enhanced collaboration between community-based initiatives and government agencies, improve epidemiology and surveillance related to substance misuse, as well as support federal, state, and local policies and legislation to reduce substance abuse and overdose. So the strategy categories that you'll see in the plan focuses on education and prevention, policy, justice system involvement, treatment, overdose, community collaboration, as well as data. And so a few highlights of some of the current efforts that the task force has been working on. The City of Milwaukee Fire Department and Alderman Murphy and Alderman Bowl have partnered, so now that the fire department has more envelopes that can be used by residents to take their medications back and dispose of them. The county is, they've applied for supplemental federal funding from the state targeted response program, and that's for individuals waiting for residential treatment specific to opioids. And they also are moving forward with their opioid death investigator position. The Medical College of Wisconsin and the county are also collaborating to expand treatment opportunities within the community. And then the City of Milwaukee's Health Department and the City of St. Francis Mayor are planning a spring kickoff event. So the task force has been extended. So we are going to be meeting quarterly through January of 2019. We are planning to release an initial plan this spring, hopefully by April. And once that initial plan is released, we will be doing community outreach to identify the existing efforts and gaps, and then developing a framework based on that. And then we are hoping once the task force wraps up, we will submit final recommendations. And as far as implementation, monitoring, and sustainability of what the task force does, that's still yet to be determined. Thank you.
Very good. Alderman Borkowski would move that the information that we received by Mr. Paul Mozini be included in the record. And there are a series of questions that I will forward to you, and perhaps you can respond to that individual, okay? I've got 2 pages of questions here. I'm not going to go into all of them. But I will ask, one overriding concern apparently is lack of control, I guess, of physicians that may be prescribing opioids unnecessarily. What is your take on that? What, if anything, or influence does the task force have? I know that, of course, there's a medical review board and so on. Are they engaged? So on and so forth.
Sure.
If you could discuss that.
It's a very appropriate question. We've had representatives from the Drug Enforcement Agency come to the committee and testify about what efforts they've embarked upon in terms of going after quote-unquote pill doctors. The gentleman that you referenced in the questions asked a very legitimate question. So I do plan on following up with the DEA agent, Bob Bell, about the prosecution of individuals who've been prescribing pain medication far in excess of what would be legally required. So I will be getting a follow-up, hopefully, from Mr. Bell on that issue. As was communicated to us from the DEA, that they're aggressive in prosecution in those areas, and that they feel that they've done a good job of trying to curtail those doctors who are abusing that privilege of prescribing medication. But there may be some valid concerns that were raised that I'll follow up with Mr. Bell. And I'll make sure this committee and the gentleman in question get an answer after I get a response from the DEA.
Very good. Thank you. Go ahead.
Also, Mr. Chair, there have been some efforts at the state level in that regard, and I'd be happy to follow up with you and send those to you.
Okay. Good. Any other questions or comments by committee members?
If I could just mention, Tiffinie's position is obviously new. It's the Substance Abuse and Injury Prevention Manager. So she's not only dealing with substance abuse issues, but we're looking at injury prevention more broadly in terms of the social determinants of health. So if you'd like us to come and meet with you and talk to you about that, we'd be happy to do so.
Well, I certainly welcome you on behalf of the committee and appreciate your efforts. I know it's been challenging for the task force because of that vacancy for 6 months and 7 months. And so that made it difficult to move forward, but I know you guys are doing a great job, and we appreciate it very much.
We've had 2 listening sessions and had good response from the public, and we do anticipate having a preliminary draft released in April and then a final draft following thereafter. So we value any suggestions at this point in time. We're embarking and looking and working on getting a prevention campaign. I know Alderman Lewis has done a great job in using social media sites, and I'm not very good at that. I have to ask my 12-year-old daughter how to do those things. But you know, and we are going to be focusing a lot working in the South Side. Unfortunately, the South Side has been hit very, very hard.
I know.
And looking at some options. So I will be specifically working with you, Alderman Donovan and Alderman Perez, because we know by looking at the maps. One thing I'll tell you is the fire department has been doing a remarkable job. So why we included the envelopes for the fire department last year responded to over 3,400 saves. In terms, think of that. They went out and distributed and administered people who were non-breathing and giving Narcan. We'd be having a much different discussion today if Narcan was not being used, right? I mean, we'd be talking 1,000 people dead. So it's a very sobering statistic in which that's why we trying to get the medication out of the hands of young people who get access to it in many respects to the medicine cabinets is one small component of the prevention campaign. But I think trying to figure out how we can provide greater treatment options and targeting on the South Side is something that I'm going to work with you. And before we do anything, we want to get your buy-in because it makes no sense if you 2 gentlemen don't support it. So we want to kind of figure out what you think will work. And I am working with, like, for example, Safe and Sound, Katie Sanders. They're recently going to be hiring a new a person who specifically, they got a grant to deal with the issue of addiction and drug overdose deaths. So thank you.
Very good. Thank you. Any other questions or comments by committee members? If not, Alderman Borkowski would move to receive and place on file, and hearing no objections, so ordered. Thank you all again very much. There being no further business to come before the committee, we stand adjourned.